RelayHealth is a web-based solution which facilitates effective and efficient care coordination by allowing both providers and their patients to securely communicate and share health information when and where it is needed. The service offers the highest level of security to protect the privacy of healthcare information transmitted through the service and supports collaborative, patient-centered models of care by providing individuals and their care team with access to a common community-based personal health record, or PHR. With significant changes in our healthcare landscape, there is a growing urgency to improve the care of an increasingly large, aging population suffering from complex and chronic disease. Often with multiple health conditions and functional limitations, these patients require coordinated medical and social support services from a wide variety of care providers and settings. With RelayHealth, community-based solutions can be realized to ensure that our complex patient populations receive the comprehensive care that they need and deserve. As a patient's care team expands, specialists and other healthcare professionals can connect on the Relay Clinical Service to access a common medical summary and care plan, review laboratory results, and verify medication lists. In addition, the service offers secure electronic communications between the care providers as well as to the patient, which helps prevent duplication and ensures the ongoing delivery of safe and coordinated care. With access to their personal health information and the ability to collaborate with their care team from the comfort of their home, patients and their families are empowered to take an active role towards the prevention and self-management of their chronic disease. With a greater understanding of their medical conditions, patients are more likely to comply with their medication regimes, change unhealthy behaviors, and stay on track with their care plans and self-monitoring. Meet Russell and his daughter Sherry. Russell was diagnosed with type 2 diabetes at the age of 63. He successfully managed his condition for over 2 decades by keeping up with his medication and taking long walks with the support of his wife. Now 83 and living alone in his apartment, his daughter has noticed a significant decline in his ability to care for himself. Increased confusion regarding his insulin doses, coupled with a bad fall last year and a recent COPD diagnosis, have left Russell cooped up in his apartment and unable to exercise on a regular basis. Sherry is her dad's primary caregiver and lives an hour away with her family. She calls him multiple times a day to remind him to take his medication and accompanies him to all of his appointments. Never did she imagine that it would be so difficult and time-consuming to coordinate and monitor all of her father's medical and social support needs. When Russell's primary care physician introduced Sherry to RelayHealth, she was thrilled that she could access her father's personal health record on his behalf, request appointments and communicate electronically with his care team, and that everyone would be accessing and sharing his latest clinical results and care plan. Let's take a quick look at how RelayHealth helped Sherry get the information and answers she needed to care for her dad while away on a recent business trip. After one of her routine calls to her dad, Sherry was concerned about his blood glucose levels and quickly logged into RelayHealth to access his personal record from her hotel room. She reviewed his latest blood glucose levels, and then took a look at his diabetic action plan that her dad's physician had uploaded to his record. She quickly realized that her dad's situation was not in control and that she needed to reach out to his care team. Sherry sent a quick message to Dr. Graham to get his medical opinion. The following day, Dr. Graham logged into RelayHealth and accessed his practice's new messages. He reviewed the details and noticed right away that the message was from Sherry on behalf of her dad and that she had concerns about his fluctuating blood glucose levels. Dr. Graham decided to take a closer look at Russell's health record. He reviewed his current list of medications, his self-monitored tracking levels, as well as the results from his latest blood test. Dr. Graham agreed with Sherry's concerns. Russell was not managing his condition very well and needed to be seen for a follow-up appointment. Dr. Graham conveniently replied to Sherry's message and copied Russell's home nurse to confirm his findings and to provide his recommended course of action. He also attached a link to a trusted medical website to provide Sherry with some helpful information that they could discuss in further detail at her father's next appointment. When Sherry received the doctor's reply message, she was relieved and felt confident that her dad was going to be okay. With his medical advice, detailed written instructions, and the additional educational material, Sherry and Russell's care team were all on the same page and knew exactly what to do.